everybody, and welcome back to another episode of Hybrid Healing Hour. Today, we are going to be discussing shingles. Shingles is also called herpes zoster, and it is a disease that triggers a very painful rash. It is caused by the same virus as chickenpox, and about 1 in 3 adults who had chickenpox will develop this at some point in their life.
Yeah, and an estimated 1.2 million people get shingles every year in this country. So that's a lot of people, and it's a disease that people don't think about until they either know someone who has it or actually have had it themselves.
And as we mentioned before, this is developed if you've had chickenpox, you may develop shingles. And if after chickenpox, basically the virus stays dormant in your body for the rest of your life, and years later, the virus may reactivate as shingles. It's known, or it isn't known what reactivates it. However, we do believe that viruses tend to be reactivated by stress and a decreased immune system. And we know stress can decrease your immune system. And we'll touch on that a little later when we get to the treatment.
Yeah, the virus that causes shingles is the varicella zoster virus. And like you said earlier, it's the same virus that causes chickenpox. And the amazing thing about viruses is that viruses can live in your body forever. We think of viruses as these, little periods of time that we're sick for a little while and then we get over it and it's gone. But that's not true. And there's plenty of viruses that wreak havoc on us for many years after the infection appears to have cleared. And the fact that the shingles virus stays dormant, it goes to sleep for all these years and all of a sudden wakes up and causes problems again. It's amazing.
The chickenpox is dormant,
and it
wakes up as shingles.
Right.
Yeah, later in life. But I mean, it goes hand in hand with many other viruses, like when you get mono as a young person, young adult, or kid, then it develops. Epstein-Barr virus is with you forever, and it can develop and reactivate later in life as well.
Exactly. So later on, we're going to talk about how to optimize your immune system to prevent these viruses from reemerging.
So what does shingles look like? So it is typically a strip of blisters with a red, what we call erythematous, a red base, and like I said, blisters. So it's not pimples. I always describe this to people. It's vesicular, so it's fluid-filled blisters, and it usually only involves the body or the face, and it's on one side of the body only. It will never cross the midline of the body. So if the midline of the body is your belly button straight up through your chest, the middle of your chest, your sternum there, if you have a rash that goes across there and it's on both sides of the body, it's probably not shingles. It usually is only on one half or the other.
And we have plenty of patients who come to us who have a rash. And they say, I think I have shingles. And we look at it, and in 1 second, we'll say, that's not shingles. And they're like, well, how do you know so fast? It's because it's on both sides of the body, and shingles just doesn't do that.
And there is something in our body called dermatomes, which is stemming from the nerve roots in the back of our spine. And we know these dermatome patterns, which are in I guess you could say a horizontal line all the way across the body, all the way around, I guess wraps around the body, right? And we know that typically shingles will only stay in like 1 or 2 like dermatomes.
And you described what the vesicles look like, and since it's a herpes virus, it's very similar to other herpes infections. And we were always taught that in medical school, herpes looks like dewdrops on a rose petal.
Yes,
right?
That's a classic book terminology, I think, for the chickenpox description. Exactly. Actually, so board question there. So. Can you go ahead and tell us some symptoms of shingles?
Okay, so the first one is going to be pain, burning, and tingling. So pain is typically the first symptom of shingles, and for some people, the pain can be intense, and the pain can come on long before the rash comes on. So when people come in with chest pain sometimes, we have to think in the back of our mind, this is an atypical chest pain presentation. Could it be shingles? Sometimes people can come in with a headache or severe eye pain. And then comes sensitivity to touch. So it's like when you're coming on with any kind of viral infection, your hair follicles get sensitive. You can feel that.
Your skin is sensitive.
Right.
It's just like, it's like that
just a
sensation. Touch. Yeah.
And so then comes the rash, and the rash can typically present a few days after the pain. So we don't look for the rash first if someone comes in complaining of pain symptoms that are in a dermatomal pattern like you described. And then you'll get the vesicles, which are those little fluid-filled blisters getting break open. Then comes the healing process, in which it really starts to look ugly, where the blisters start to crust over, and you get this scabby-looking appearance along the blisters. But that typically means that you're starting to heal and you're getting over it. And itching can occur throughout the whole process once you have the rash, and itching can be intense as well.
And just like any other virus, some people can also feel fatigue, fever, headache, and be sensitive to light.
So the question comes, when should someone see a doctor if they think they have shingles? So we tell our patients that typically if the pain and rash occur near an eye, you should be seeing a doctor, because if left untreated, this infection could lead to permanent eye damage. People who are 50 or older, because age increases your risk of complications. And we have seen young people with shingles. My youngest patient I've seen with shingles, I think, was like 15 or 16. It's rare, but it can happen. If you or someone in your family has a chronic illness with a weakened immune system, and that can be from cancer or cancer treatment, it can be from certain medications.
Or organ transplantation.
Exactly, or any chronic illness, then you should probably come in for treatment. And if the rash is extremely painful or extremely widespread, you should be seen.
As you've mentioned right there, there's lots of different severities of this. I've seen very mild cases where somebody had like 2 blisters and just a little bit of pain and not much, and it healed over. And we've seen very, very severe cases where it was in the eye and on the face and into the scalp, and the wind hurt, it hurt to blink, it hurt to close the eye. It's very terrible. So the most common complication is post-herpetic neuralgia. This is the painful condition that causes shingles pain, and it can last for a very, very long time, even after the blisters or the rash has cleared. This is what creates damage along the nerve line, as we mentioned already in the dermatome. So these are nerves. This is nerve pain. It's inflammation of the nerves. And if anybody's ever had like sciatica or any other nerve pain, you know what that pain is, and it's very irritating. And it can hurt with movement, without movement, just sitting there, anything you do. And unfortunately, this post-herpetic neuralgia, as it sounds, it's after rash and it's nerve pain. And this can last months, years. It could last for the rest of your life, unfortunately. And about 10 to 18% of people who have shingles will experience post-herpetic neuralgia. So your risk of this increases actually with age. And that's why we worry more if you are 50 years and older, you're at higher risk for complications. So we consider this a complication. In older adults with shingles, they're more likely to develop this and have longer lasting and more severe pain than a younger person, as you mentioned. And anybody younger than 40 years old actually rarely experience the post-herpetic neuralgia. So typically, like you said, with a 15-year-old, yes, you can get shingles at a younger age, but luckily you're able to recover and rebound from this much better than when you are 50 and older.
And until you've actually met or talked to someone who has severe post-herpetic neuralgia, you can't imagine how painful this condition is. I've had several patients through my career who tell me, I can't live like this. This is so bad that I just can't function. I can't leave my house.
I had a patient a couple years back who was thinking about getting the vaccine, and unfortunately her insurance wasn't covering it, and it wasn't cheap, I would say, at that time, and or easily affordable, because as we get into that in just a little bit here, we're going to discuss how it is 2 shots now, and so she was going to have to pay for each one. So she was like, okay, I'm going to plan to get that done in the next month. Within a week or 2, she developed terrible shingles right on her forehead, and it was luckily it missed the eye, but it was all around the eye and in the forehead into the scalp, and she continued feeling nerve pain for, I think it was 6 months later even, until it finally was dissipating. But we tried, medications, everything. She just kept saying, when will this go away? And unfortunately, my answer was, unfortunately, we don't know if it will, and it's just when you see people that have this and experience this, it makes you want to do everything possible to prevent this.
And as bad as that is, that's not the only complication of shingles. There's also Ramsay-Hunt syndrome, which is also called herpes zoster oticus. And that occurs when a shingles outbreak affects the facial nerve near one of your ears. And it's typically inflammation of the geniculate ganglion of cranial nerve 7. And this can cause facial paralysis and hearing loss in that affected ear. It can also cause like a facial droop, facial paralysis. And the symptoms could last for a few weeks and even up to a year or longer in cases. And this hit the news and was well publicized in 2022 when Justin Bieber was affected by it. And you can go online and look at pictures of Justin Bieber during this time, and it's pretty noticeable. It looks like Bell's palsy or a stroke.
Right. And once again, this can last a while for your nerves to regenerate and get the movement back in your face. And so let's talk about vaccines. First, there was Zostavax. So Zostavax came out in the early 2000s. It only had about 50% efficacy rate. And after about 8 years, it actually dropped down to about 35%. So we saw that it was not as efficacious as we were hoping it was. But at that time, it was the first vaccine we had for this. And we did know that it still limited the risk of getting shingles. And if you did get shingles, it still reduced the severity of it. So it was still beneficial. It was a live vaccine though. So you had to make sure that if you were immunocompromised, it wasn't the best one for those people. And but now we have a bigger and better one because now Zostavax is no longer available in the U.S. as of November of 2020. So tell us about Shingrix.
Right. So Shingrix came out to replace Zostavax. And for a while, I think in the beginning, they were both being given
for a little while
at the same time. But Shingrix is by far a better vaccine. And I know that now in the news, vaccines have gotten a bad reputation and there's a lot of controversy, especially over the COVID-19 vaccines. And we don't want to get into all of that. But I will tell you that shingles is horrible and you don't want to get shingles and you want to try to prevent yourself from getting shingles. Shingrix in adults aged 50 to 69-year-olds with a healthy immune system, it's 97% effective at preventing shingles. And in adults 70 years and older, it's 91% effective. So significantly more effective than Zostavax was.
Yeah. And in adults 50 years and older, Shingrix was 91% effective in preventing post-herpetic neuralgia. And in adults 70 years and older, it's 89% effective. So we definitely see an improvement. I mean, if I can prevent pain, I don't want, I'll get the vaccine for that. And so it's definitely recommended in adults 50 years and older.
It's also recommended for adults 19 years and older who have a weakened immune system because of a disease or because of therapy that weakens their immune system.
So we give this, there's, like we mentioned already, it's 2 injections, and we give it about 2 to 6 months apart. So you get your first shot, and then about 2 to 6 months later, you can get your second shot. And we do know that the second shot can be worse. Clinically, we see this. But you have to get the second shot. That is for the best efficacy of this vaccine. And what I mean by the second shot can be worse is you might feel more fatigue or soreness, achy. I mean, this can happen in chills.
Chills is what I see the most. Chills and a sore arm. Those are the 2 most common things I see after the vaccine.
I've seen where people just feel kind of like run down in general. It's kind of, you're boosting your immune system. You're getting an immune reaction from this. And this is making your body stronger in order to fight this off. So I've seen this even with my own parents, but it doesn't mean everybody's going to get it, because I love telling the story that my mom and dad got it done at the same day in the morning. I called them on my way home from work, and my dad was telling me how it was such a doozy. He was feeling like a little drippy nose. He felt achy and run down and just really tired. And my mom's like, I'm totally fine. There's nothing wrong with me. And so I warn people of this because we want you to be prepared in case you want to get the shot. I've had some people where they plan to get it on a Friday so they don't have to worry about missing work Saturday if they want to, if they just want to lay around and relax and let their body handle it naturally, So you can plan ahead for that, but it's not bad at all. And it's going to last maybe for the rest of the day, and then you'll wake up feeling fine the next day.
And shingles is far worse.
Absolutely.
So, and studies have shown that the immunity will stay strong for at least the first 7 years after vaccination. And it's probably longer, but the studies haven't gone out that far yet to tell. In our practice, we get a lot of questions from patients saying, should I get the vaccine because I've had? So let's talk about some different case scenarios. Who should get the shingles vaccine?
Right. So I usually recommend anybody who has had shingles before, because you are at an increased risk of having shingles again. And it doesn't mean that the second time is going to be worse, but it also doesn't mean it's going to be better.
Yeah.
We also recommend, if you've had Zostavax, as we've already mentioned, that the efficacy rates of that is much lower. So you can still get the shingles vaccine now, the Shingrix.
And I have a lot of patients who tell me, well, I don't ever remember having chickenpox. It doesn't matter. Even if you don't remember having chickenpox, a lot of people have had subclinical chickenpox. I myself have never recalled ever having chickenpox. No one in my family ever recalls me having chickenpox. But when I did my titer, sure enough, I had chickenpox at some point. More than 99% of Americans born on or before 1980 have had chickenpox, even if they don't remember having had the disease.
So I just learned this one, that you should still get the Shingrix vaccine even if you did have the varicella vaccine. Because I forget what year they came out with that, but it was after me, because I got chickenpox, and they started vaccinating for chickenpox now.
Yeah.
And then so there's no maximum age for getting Shingrix either.
And who should not get the shingles vaccine. So it's not a live vaccine, so you don't have to worry about the immunocompromised people. You have to worry about anyone who's had a severe allergic reaction to any component of the vaccine, or if they've had a severe reaction to the first dose of vaccine, then I wouldn't give them the second one. We also don't want to give it to anyone who currently has shingles. Now, we can give it to someone after the rash is cleared up, and there is no time frame there's no advice as far as when or how long you should wait. The recommendation is that once the rash is completely gone and you're symptom-free, you can go ahead and get the vaccine. Also, if you're currently pregnant, women who are pregnant should absolutely wait to get the Shingrix vaccine till after they've delivered.
So are people at increased risk of getting shingles again after having it once? As I've already mentioned, about 1.2 to 9.6% of people with shingles may develop another shingles infection or recurrence. Recurrence is more likely in people who have a weakened immune system, as we've mentioned, with cancer, organ transplant, chronic disease. But up to 18% of people with a weakened immune system may get shingles more than once. So it's quite a significance from 1.2 to 9.6% up to 18. So is shingles contagious?
You cannot get shingles from someone who has shingles. Now, that does not mean that you can't get chickenpox. You can get chickenpox from someone who has shingles if you've never had chickenpox or never had the chickenpox vaccine. And typically it's contracted through direct contact with the fluid from the shingles rash blisters or breathing in the viral particles that come from the blisters. But that person who gets it will develop chickenpox, not shingles. And then they could develop shingles later on in life. People with chickenpox are more likely to spread varicella zoster, though, than people with shingles. It's not likely. And so typically we tell people, stay away from pregnant women, stay away from people who've young children and people who've never been vaccinated, or people who are immunocompromised.
Right. As we know, chickenpox is highly contagious. And back in the day, they used to even have chickenpox parties, but you don't have to do that anymore since they have the chickenpox vaccine. But shingles is not as contagious as chickenpox. And so I get asked a lot, well, how do I prevent this from spreading? And as we already said, it's not as contagious as chickenpox is, but you still could cover the rash and you could avoid touching it or scratching the rash. And if you do, you should really wash your hands. Soap and water as often as possible, maybe, and do it for at least 20 seconds to really, what's the song? You can sing Happy Birthday, or I forgot the one that they teach you in nursing school.
Yeah.
But anyway, you want to avoid contact with people until your rash has scabbed over. When it's scabbed over, that's a sign of healing. And I also can't talk today. I also tell people that until you're not getting any new eruptions, like you don't want any new vesicles to appear, because if that's happening, you're still contagious. Let's talk about treatment.
Okay, so there's several treatments that we can use, and none of them are really super effective, but they're better than doing nothing at all in some cases. For post-herpetic neuralgia, we use something like gabapentin, which helps cool down the nerve impulse and the nerve pain. Initially, the first treatment is antivirals, and that's like acyclovir, valcyclovir, medicines like that, and you need to treat them early. So they should be administered within 72 hours, and even then, the earlier, even if you administer them immediately, it only reduces the length of the illness by maybe 2 or 3 days, and it decreases the severity a little bit. So we do start patients, but we tell them that, you're still going to have to go through some of this. In cases where there's a lot of inflammation, we can use steroids. But the most important treatment is really things like daily cleansing of the blisters, which reduces the risk of spreading the infection. We tell people to take a cool bath or shower to soothe the skin. The coolness of the water can ease the pain from the blisters and calm the itchiness. Applying a cool, moist compress several times throughout the day can help. And we just take a towel with cold water and just apply that, and that helps with some of the itchiness and the pain. You can create a paste using cornstarch or baking soda and water, and that helps decrease the itching. Oatmeal helps, and we used to recommend oatmeal baths a lot, and I don't see that recommended much anymore, but it's still helpful, especially if you combine it with lavender essential oil. And that usually helps with the burning and the itching of the shingles. And then there's witch hazel, which is available in a cream that you can add to your skin when there's a lot of itching, pain, and inflammation from the shingles rash.
Right. And what we always go back to on our podcast is more the functional treatment. And this isn't really a treatment, but I'd say it's more prevention. It comes down to your immune system, as we've already mentioned.
And your gut.
And your gut, exactly. So we know that your gut holds about 70 to 80% of your immune cells. And if your gut is not balanced and your immune system is not functioning well, you are at increased risk. So it begins with what we're eating over a long term. Many people nowadays with the Americanized diet are lacking the nutritional needs and vitamins and supplements to support a healthy immune system. Another thing that people have to realize is stress. When you're stressed, your immune system is stressed. And stress is something that people can, I think, handle and you don't realize. It's like a subconscious thing that you don't realize when you're stressed out. And I think everybody needs to take a timeout. I call it a timeout, like a 10-minute timeout at minimum every day to have peace and quiet. I always like to advise on meditation. So many people are like, well, I don't know how to meditate. Okay, well, there's apps for that. There's an app for everything these days. I mean, I personally use the Insight Timer and I like it a lot. But we did a podcast on mindfulness. Even just doing that mindfulness, go back and listen to that. If you haven't, you should learn something from it.
And the leaky gut one too.
And the leaky gut one. But back on the meditation, it's just how you can practice de-stressing every day. And I always say this, like a professional baseball player, when they make it to the big leagues, they don't stop practicing. They continue to practice in order to stay good. You can practice de-stressing in order to stay not stressed during your everyday life and learning how to handle the stress. And also sleep. We know sleep is critical, and this helps to establish a good circadian rhythm, and that is actually supportive of the immune system. Your immune system goes off circadian rhythm. Your gut does too. So these are all very critical everyday practices that you should have in order to prevent any stressful outbreaks or reactions to and decreasing your immune system. Now, sometimes people take L-lysine. I've been asked, does this help? Because I have some patients who take the L-lysine for herpes, for HSV, for cold sores on their mouth. And there hasn't been any evidence to support that in the treatment of shingles, but I also don't think it would hurt.
Right. And we also use mushroom complexes, mushroom blends that help with immunity.
Adaptogenics are huge for your immune system.
Yeah. So diet is crucial. I mean, you should be eating a healthy diet anyway, but when you have shingles, that's really the time to buckle down on your diet and be as clean as possible. Stay away from sugar. Stay away from all inflammatory foods, processed foods.
We know sugar and starch are highly inflammatory and can bog down your immune system.
Right. So we hope this helps. And, hopefully you won't get shingles, and hopefully no one you know will get shingles. But at the same time, it's bound to happen because it's not an uncommon disease. The information contained in this podcast is provided for informational and educational purposes only and is not intended for the purposes of diagnosing, curing, treating, or preventing any disease. This podcast is provided on the understanding that it does not constitute medical or other professional advice or services. Before using any products or services referenced on this podcast, consult with your healthcare provider, carefully read all labels, and heed all directions and cautions that accompany the products. Information found or received through the podcast should not be used in place of a consultation or advice from a healthcare provider. If you suspect you have a medical problem or should you have any healthcare questions, please promptly call or see your healthcare provider. This podcast, including Dr. Brian Marias, Deanna Weilbacher, and Hybrid Medical Solution, do not claim responsibility for any adverse effects from the use of information contained herein. Opinions of guests are their own, and this podcast does not endorse or accept responsibility for any statements made by the guests. This podcast does not make any representations or warranties about guest qualifications or credibility. This podcast may contain paid endorsements and advertisements for products or services. Individuals on this podcast may have a direct or indirect financial interest in products or services referenced.
If you would like to submit any questions or if you have any topics you would be interested in hearing about on future episodes, please contact us through our website, www.hybridmedicalsolution.com. That is solution with no S at the end. Follow us on Instagram and Facebook, all under Hybrid Medical Solution.